of Buerger disease. It is an inflammation of the blood vessels. This condition mainly affects in the hands and feet. Inflammation and blood clot can form and blood-packed flow. This leads to pain, tissue damage, and even tissue death. So, it is a rare inflammatory disease of blood vessel that gives thrombus formation, means blood clot. It usually affects medium-sized or small-sized arteries of arms or legs. Then it lead to blockage of artery due to blood clot formation. Blockage cause disrupt flow of oxygen and lead to damage to skin and even gangrene of tissue. Etiology of Buerger disease. Number 1 is disease of arteries. So, disease of arteries, example we can say coronary artery disease, peripheral artery disease, vascular diseases. Second one is trauma. It is a one-time event such as accident could take place, injury, violent attack, genetics problem, life stress. Third one is chemical exposure. So mainly it affects every organs of human body such as lung damage, neck injury, eyesight loss. Fourth one, hypothyroidism. It causes Hashimoto thyroiditis, iodine deficiencies. Fifth one is scleroderma. It is a very rare skin disease and it involves hardening and tightening of skin and connective tissue in a human body. Last one is chewing. Factor of Buerger disease. One is rickettsial infection, smoking, Raynaud disease, age between 20 to 45 years, poor hygiene, and minor feet injuries due to small accident.
Anatomy, blood vessels. There are mainly three types of blood vessels: arterial, veins, and capillary. Apart from them, we also have arteries, arterioles, capillary, venules, and veins. Arterioles. It carries the blood from the heart and it has thicker wall and it withstand high pressure. Whereas the veins, it brings the blood back from the heart and it has thinner wall and it withstand low pressures and it has large lumen. Whereas the capillary, it lies between the artery and veins. It exchanges the gas between the blood and the tissue cell. Anatomy of the blood vessels. The blood vessels has three coats known as tunica. Tunica intima, tunica media, and tunica extima. Tunica intima is made up of endothelium lines, whereas tunica extima is made up of fibrous connective tissue. Tunica intima decrease the frictions and blood flow, whereas tunica intima support the outside and protect the blood vessels. Whereas tunica media, it is a smooth muscles and elastic tissue. So this is a picture. This is tunica media, which is in between the tunica intima and tunica adventitia. Tunica intima is the innermost coat, whereas tunica adventitia is the outermost coat of the blood vessels. Physiology. Due to etiological factors such as autoimmune element, uh, the endothelium cells damage and clotting take place and depositions of fibrino occur, and because of this the flow of the blood is being reduced, and because of that there is no or less supply of oxygen, and because of blockage or less circumference of the blood vessels. So as the injury site, the tissues cell release platelets and clotting factor prothrombin activator, that is called thrombokinase, and calcium ion, whereas the liver release vitamin K called prothrombin. The the thromboplastin and prothrombin with the calcium, it convert the prothrombin into thrombin, whereas where the prothrombin is inactive form and thrombin is active form. This thrombin active the fibrinogens or convert fibrinogen into a fibrin, and this fibrin form a mesh like structure in which red blood cell get trapped and clot is formed. Etiologies such as hypersensitivity tobacco product cause autoimmune ailment because it is the only tobacco which trigger the immunity system. Thus, it will cause molecular mimicry, which is the result of autoimmune ailment. And this autoimmune element will cause inflammations of the small and medium sized vessels by damaging the endothelium cells of the blood vessels. And after that, the inflammatory factors like neutrophils, lymphocytes and other cells comes into the inflamed artery and veins. And because of this inflammatory process and migrations of neutrophils and other dead cell, there will be accumulations of the cell which is called as microabscission, and there will be formations of the blood clot in the lumen of the blood vessels which will obstruct the flow of the blood. As a result, luminal thrombotic will occur. Again, due to inflammations, there will be depositions of fibrin in the wall of blood vessel. As a result, the diameter of the blood vessels will decrease and the blood vessels will be stiff and thickened, so there will be impaired blood flow. Due to reduced flow of the blood, called ischemia will take place, so there will be less oxygen supply or no oxygen supply to the organ or the tissue, so the cell or tissue will be dead, which is called as necrosis.
Clinical manifestation of Buerger's disease. Claudication. Pain is felt on the feet, arms, or hands due to lack of blood flow. Pale reddish or blue tinted of hands when exposed to cold. Cold sensitivity. Paresthesia, tingling or numbness sensation in arms, feet, and legs. Gangrene, death of tissue which is caused due to the lack of blood flow. Autoamputation, spontaneous detachment of organs from the body. Diagnostic evaluation. Blood tests to find out the condition which causes signs and symptoms. Angiography. This imaging test is to see the narrow blocked arteries in our bodies. Ultrasound to create pictures of the blood flowing through arms and legs. This test is to check the blood flow through the arteries carrying blood to our hands.
Now come to the complication. The possible complications from Buerger disease include: first is changes in the way you walk or move due to pain. Then ulcers. Then gangrene means tissue damage. Conclusion: Buerger disease is a disease condition in which there is an inflammation of small and medium sized blood vessels. Although no treatment can cure the disease, the most effective way to stop the disease from getting worse is quitting all tobacco products. The primary treatment for Buerger disease is the complete cessation of the tobacco and marijuana used in any form. Quitting smoking can prevent progression of the disease. Next is avoiding cold weather. Conservative management includes avoiding limb exposure to cold temperatures. In some cases, pain can be controlled by avoiding cold weather. Now, come to the medical management. A variety of drugs have been tried to treat the Buerger's disease. For example, pentoxifylline. It increased the flexibility of RBCs and helped them to reach the microcirculation in a better way to increase the oxygenation. Then aspirin. It is an antithrombotic drug. Then xylostazol. It improves circulation. Next is analgesics. Analgesics are used to relieve the pain. Then xanthine nicotinate. It is given to promote the ulcer healing. Although these drugs do not stop disease progression, they can be used for only reduce the pain. Management assessment. Collect the information about the patient. Monitor vital signs. Assess the nutritional level. Now come to the surgical management.
First one is sympathectomy. It is a procedure performed to block or cut the sympathetic nerves and increases blood supply to the skin. Next is implantation of spinal cord stimulator. Here, implantation of spinal cord stimulator can improve distal blood flow and reduce pain and decrease the rate of amputation. Third one is bypass surgery. Bypass surgery typically is not an option because of the involvement of smaller and distal vessels, but may be used in selected patients with severe ischemia. Fourth one is amputation. Amputation is the removal of a limb from the body. Painful ulceration may require finger and toe amputation.
Nursing diagnosis: ineffective tissue perfusion related to arterial insufficiency, impaired tissue integrity related to altered circulation, risk for impaired skin integrity related to altered circulation, risk for peripheral neurovascular dysfunction related to vascular obstruction, ineffective health maintenance related to tobacco use, disturbed body image related to disease manifestation and or amputation. Amputation means the action of surgically cutting off a limb. Impaired physical mobility related to tissue loss, pain, amputation. Stop smoking and amputation will be avoided. Bedridden patients should be educated about the importance of protective heel pads. Advise not spending long period of time in cold temperature. Maintain a healthy diet and appropriate caloric intake.